Respiratory system, let's cover it. So some of the equations that we are going to be using include ventilation, which is very similar to blood flow. We discussed the principles of blood flow and the variables that it can affect it. But ventilation, it's the same thing essentially, but you're dealing with airflow instead of blood flow into or through a rigid tube. We're going to say this is a rigid tube. So it depends on a couple of important variables, what the pressure difference is between the outside versus the inside. The radius of the airways, that's actually the most important variable that can be affected, especially if a patient is having asthma. We said what receptors are found in the lungs. How many lungs do you have? 2. So beta 2 receptors are found in the lungs. If I stimulate beta 2 receptors with epinephrine, albuterol, or salmeterol, that opens up the airways. Viscosity and length, we won't discuss too much when it comes to this. Most important, we're going to deal with an oxygen mask as well as bronchodilators. VA stands for alveolar ventilation. That means the microscopic sacs in the lungs, which are called alveoli, how much air is actually flowing to them so that I can have gas exchange from the lungs into the blood. This represents the blood. It depends on what we call tidal volume and dead space volume. We'll discuss that when we come across it. And then also breathing frequency. Diffusion equation, we just went over that. Remember it because I will test you on it. Let's move on. What are the structures found in the airways? The important ones are butt loop. For air expiration, we'll do the reverse for inspiration. But I remember butt loop, BTLP. This is air expiration. That means from the very bottom branches, we call these the bronchi. We're keeping the structures big. It travels through the trachea. The trachea is also known as the windpipe. Yeah, that's this thing right here, windpipe. And then we have the larynx. What is the larynx also known as? And it's not larynx. Some people actually say larynx. They say pharynx. It's larynx, R-I-N-X, like, or R-I-N-K. So larynx, and that is the voice box. What is P? Pharynx, and that is your throat. That is the passageway between either going into the esophagus for food or into the trachea and larynx for wind. So here are the structures from inside out. Bronchus or bronchi, B, T, L, and P. Bronchus, trachea, larynx, pharynx. But we have to add on to those structures. This is for air expiration. They're very tiny microscopic sacs in the lungs are called alveoli. From the alveoli, it goes to bronchioles. There, just remember, little bronchi. So there are tiny little branches. Then it becomes bronchus, trachea, larynx, pharynx. From the pharynx, it'll pass through either the mouth, right, for air expiration, or through the nose for air expiration. So what is true for the reverse? Air inspiration is through the nose and mouth into the pharynx, 3 different parts for the pharynx. If it's close to the nose, it's called nasopharynx. If it's close to the mouth, it's called oropharynx. If it's close to the larynx or voice box, it's called laryngopharynx. From there, it passes through the larynx, the trachea, the bronchus, the bronchioles, and finally the alveoli. Stop there.